Okay. Hello there. My name is George. I'm with Philips Respironics, and today we're going to be going over a brief review of the Trilogy ventilator. Now, typically with this type of ventilator, this has been in use for over 15 years now, and there are three different types. There's a 100, Trilogy 200, and a Trilogy 202. Just to give you an idea, typically what you see in the home care environment is going to be a Trilogy 100, which is more or less the same as a Trilogy 200. But the Trilogy 200 does have these prongs right here. They're going to be attachments, which allows a Trilogy 200 to use a flow adapter proximal to the patient. The only difference between the Trilogy 200 and the Trilogy 202 is going to be right back here, the blender. The 202, and how I always remember that, is O2 blender, 202. Now the Trilogy itself is 11.5 pounds without the blender. If you're going to see the Trilogy 100 that typically you'll see in home use, you will not have this blender here. You will have a white elbow for a low flow oxygen connection unit, and that's exactly what you would use here in the hospital too if the patient is on oxygen. It could handle up to 12 liters per minute of O2 flow. Let's turn the Trilogy on. Right here is the on-off button. Of course, the ever-important alarm silence button. And then if you remember the old Nokia phones, you could see here, which is kind of intuitive and a bit dated, is the control panel of how you're going to navigate through. So to turn the machine, turn the ventilator on, it'll beep, do a self-test, and it is working. Now, just to reset, there was an alarm, and alarms are always going to be listed until it's reset. Any previous alarms that have went. So this is your LED screen right here. Now, in order to navigate through the menus, you just follow the prompts here. Of course, you can see right here 100% oxygen. Now, you will not see this typically in the Trilogy 100 or the 200, being because those do not have a blender. Those are going to be only low flow oxygen ventilators. Nebulizer button right here. If you were to press this anytime you put a nebulizer in line, because the ventilator itself is extrapolating through its algorithm of from pressure and flows to determine volumes. If there's any kind of exterior flow placed in circuit, like a nebulizer would be, the ventilator needs to know that. So this, you would press the nebulizer button when running a neb through the circuit. The menu button, just that, follow up, and that'll allow you to go into the patient menu. Now just keep in mind, this is not the provider or clinical menu. This is just the patient menu that they have an option to view at home. So you cannot change any primary or secondary ventilator settings here. Now, speaking of primary and secondary ventilator settings, you can see here it says switch to secondary settings. This Trilogy is capable of keeping in memory two different settings. Typically, it could be anything from nocturnal and day settings. It could have secondary settings like rescue settings when the patient's having a difficult time or a bit of an exacerbation or so, and other reasons too. But this ventilator does have that capability. In order to switch to secondary settings, that's the first highlighted option you see. You would just press select. And then this ventilator will always prompt you again into making sure that that is the decision you want to make before you do make it. So it'll also prompt you to switch secondary settings. Once again, just hit yes. Ventilator is now in its secondary settings. You can see that by this top left-hand corner, passive, which means that there's a passive circuit. We'll talk about that in a moment. 2 means that's secondary settings. And these are pressure control, mouthpiece ventilation, MPV. Those are the patient's secondary settings on this ventilator currently. Now let's go back to primary settings. We would, once again, switch to primary settings. We would select that. Once again, just follow through the prompts, switch to primary settings, yes. And now we're back to passive 1, which is a primary setting, which just happens to be AVAPS AE. That's average volume assured pressure support, auto EPAP. Continuing down, like I said, it's You could think of the old Nokia phones. You just follow the arrows and continue down to My Settings. You just select this. This is just, keep in mind, this is just for the patient to be able to have control at home. Rise time is 3, so that's more of a comfort setting for the patients. And of course, nebulizer enabled. It's not on, but that is the nebulizer feature. You can actually change that to off by, once that is highlighted, hit modify, turn that off, and we'll see if we finish and exit. Now, if you remember, there was a nebulizer, activate nebulizer button. That is no longer there. That's because we just turned it off, and the patient does have that capability of doing that at home. Once again, we'll scroll down to My Settings, highlight nebulizer enabled, and turn it on. So now that's going to be enabled once again. Now, to do vent checks, that's one of the more important things. We can go through options. Let's take you have things as alarm volume. You could lock the keypad, keypad backlight, LCD brightness, all things like that, just so you folks are aware. So that could change any kind of screen dynamics. Alarm log will be just that. That'll give you a log of all the latest, the last alarms that have been off. But to get into the ventilator check and to be able to look at the mode and the settings, you would go to Information, select, and now you could see Primary Settings and Alarms. This will scroll down by page. So take your dual prescription on. That's because we do have that option on. Mode is AVAPS AE, which is also reflected there. Circuit type is passive. AVAPS rate. If you folks are familiar with AVAPS, that's another discussion that we could definitely have at a later time. And here are the rest of your settings. Tidal volume, as you all know, there is a tidal volume set with this rate, AVAPS AE, and then you give your pressure support max and mins, and also your EPAP range of max and min, and those are listed right here as you keep paging down. EPAP breath rate is auto for this particular patient. That's a very unique and very good feature of the Trilogy and the AVAPS AE mode. Trigger type is flow trigger, and trigger sensitivity. So it'll give you all of those. Settings. As you continue going down, it will go into the alarms. As you can see, most of these are off. Typically, alarms are going to be set per the durable medical equipment protocols and policies, or the hospital policies here. And then you could continue scrolling down, and you're going to get to the point of going into menu access, detailed views, and things like that. Things aren't going to be as significant for a ventilator check. Of course, whenever you want to finish, just follow the prompts to get back out, finish, and exit. And now we're back to the main screen.